Nadera Lopez-Garrity. Welcome.
Chairman Wiggum, Vice Chair Stevens, Ranking Members Kelly, and honorable members of the State and Local Government Committee, thank you for the opportunity to speak today in support of House Bill 618, a common-sense legislation that would procure the checks and balances that our constitutional federal republic prides itself in upholding, yet has been woefully and shamelessly disregarded throughout these past 9 months. Witnessing the executive decisions being made that have adversely impacted the lives of millions of Ohioans devoid of the input of the General Assembly as elected by the people to represent the people has been alarming, to say the least, for an immigrant like me to witness as a proud U.S. citizen whose roots stem from a one-thriving nation that was destroyed by tyrannical leaders who disregarded the checks and balances upon which my birth country of Venezuela was founded upon. We cannot continue to let such usurpation of power take hold at a state level, lest we risk losing more as precious lives, all of which are essential, continue to fall victim to the depths of despair, abuse, neglect, starvation, and addiction, while it's being led into an economic suicide of catastrophic proportions. Initiated by decisions made by a handful of individuals who relied on a woefully erroneous model and skewed data, as noted in my previous testimony before this committee in favor of House Bill 624 on June 2nd. By this point, it's no surprise to anybody. Everybody's well aware of the fact that unemployment has a very deleterious effect on public health. And a meta-analysis of 42 scientific peer-reviewed studies conducted in 15 countries on the relationship with unemployment and all-cause mortality found that unemployment increased the risk of dying by 63%, and we are witnessing it in Ohio. The latest unemployment rate in Ohio is 8.9%, according to the Bureau of Labor Statistics, which equates to over 510,000 unemployed fellow Ohioans. An alarming rate of unemployment that has not been seen in this state since September 2011, nearly a decade ago. At the peak of this shutdown, the unemployment rate this year was 58.6% higher than the peak unemployment from the Great Recession. Soaring suicide rates, drug overdoses resulting from the lockdown, and increasing rates of unemployment is imminent with the declining mental health of our communities and neighbors. In one county alone, the number of overdose deaths increased by nearly 75%. More than 20% of those who died from an overdose this year were African Americans. The Journal of the American Academy of Child and Adolescent Psychiatry published a study conducted by a team of experts, and among the things found in the study that was reported was that social isolation and loneliness increased the risk of depression as well as the possibility of anxiety at the time of loneliness. And what was alarming to me was that young people were as much as 3 times more likely to develop depression in the future due to social isolation, with the impact of loneliness on mental health lasting up to 9 years later. Additionally, a local frontline doctor who has treated several dozen of COVID patients echoed the same aforementioned concerns and revealed some more disturbing implications as a result of the orders dictated by the governor and director of health, stating that, quote, mental health problems have been through the roof. Suicidal patient visits up drastically. Typically, we see a general improvement in weight, blood pressure, blood sugar across the board, with a few stragglers going the wrong way. Many of the patients who we have worked hard to control have now gone the other way. I have seen many teachers in the past few weeks who are on the verge of breakdown from being thrown into online learning and such. I have seen approximately 20 children with rashes on their faces from masks. One ended up in the hospital when the rash got infected and the patient became septic. Patients have expressed to me extreme anger when discussing the possibility of another lockdown. I have been getting significant pushback from different facilities due to mask exemptions I have written. An example was an individual who I wrote an exemption for who was supposed to have a cardiac stress test. The facility would not do the test unless the patient wore a mask. She said she had a mask exemption and they asked her why, so that they could verify it if it was legitimate. The patient couldn't tell the cardiac facility as to the reason why, so they wouldn't do the test. Completely unacceptable that they would ask a patient this. Obviously, this drastically violates privacy laws. However, this is fairly common, end quote. I can personally attest to the fact and the countless of ways in which the governor's orders have truly neglected to take the vulnerable into consideration, not only those in long-term care facilities that were prevented from receiving appropriate care at the various hospitals whose staff members were furloughed shortly after the initiation of the orders, but those of us who are unable to wear a mask due to medical reasons. We have been ostracized from society, gaslighted, treated as second-class citizens, in some instances unable to vote or participate in society while stopping for basic necessities with without being harassed and expected to risk our lives, while many hypocritically came to care about the most vulnerable. Those of us needing medical care denied access to treatment, testing, diagnostics care. Special needs children denied access to therapies, aside from IEP education, as well as adults. The list of atrocities committed against Ohioans at every level has been tragic and inhumane in many instances. I myself was hospitalized at the height of this pandemic due to the reasons as to which I am medically unable to wear a mask. I can genuinely say that I have never seen the hospital more dead in my life, but I digress. If there is one thing that has been clear throughout this pandemic, is that we all have already lost and suffered much. It is long overdue for the legislature to be afforded the opportunity to represent the voices of the people, as should have been the case all along. Please do not let personal conflicts with the sponsors prevent you from voting in favor of this common sense legislation that merely attempts to preserve the checks and balances that this country was founded upon and our state desperately needs. I kindly urge you to vote yes on House Bill 618 and highly advise that you read the Great Barrington Declaration, initiated and signed by more than 3,200 infectious disease epidemiologists and public health scientists, nearly 4,800 medical practitioners, and over 73,100 experts who have grave concerns about the damaging physical and mental health impacts of the prevailing COVID-19 policies. Focused approaches that could facilitate better policy-making decisions in the future are also recommended in the declaration. I am also in support of Senate Bill 311. And if I may address a concern that was brought up earlier. Lindsay Evans, actually a dear friend of mine, and I myself used to work at a grocery store throughout this pandemic during the weekends. My daughter has severe health conditions whereby I cannot work during the week. So during the weekend, I worked at a grocery store throughout this pandemic. And I can tell you, again, due to my medical conditions, I am unable to wear a mask. I was the one employee, the only employee throughout even the height of this pandemic who worked at a grocery store whereby we have hundreds and hundreds of individuals coming in and out every hour. It is a very busy grocery store. I'm the only one without a mask due to medical reasons. And there is nothing more violating than having to impose anything on anybody else. I am also the mother of a child who had severe health issues as a result of injuries that occurred due to her vaccination that makes daily life very sensitive for her. And what I mean sensitive is that everything that everybody's been going through the entire COVID time period, which means, the entire hand washing, or worrying about what you touch or don't touch. My daughter cannot go to school as a result of it. She cannot go to school. When I get home, I have to be mindful. This coat cannot touch anything. My clothes cannot touch anything. My purse has to be washed. Everything has to be washed. I have to make sure that we do not do anything that could risk her life just from me being outside in the environment because of what has been done to her system. I would not expect anybody, or change anybody's lives or infringe upon anybody's constitutional rights and freedoms because of me and our vulnerabilities. Quite frankly, I don't. So I think that is something that is worth noting throughout this process, and I thank you very much for your time, and I'm open to any questions.
Thank you for your testimony. Seeing no questions from this committee, again, thank you.
Thank you.